Dr. Montgomery, not to put you in a bad position and ask you an inappropriate question, but when you're in the secret meetings with other cardiologists and you're in that atmosphere, do you feel that, we hold doctors and cardiologists to a very, very high standard. Is there ever a time that you feel that people actually would rather have patients that they could charge expensive surgeries as opposed to recommend lifestyle changes?
It's interesting. I think there's some element of that. So what I'll say is one of my attendings when I was in training would jokingly say, about some of the private attendings bringing more patients in for heart caths. He says, must have a note to pay on the boat or something like that. So we joke about those things. I think for the most part, my colleagues, and many of them are in academic medicine, they don't sort of directly attach the number of procedures they do with their income. But most of them really think that this therapy is necessary and that it works. So there's a sense of blindness that's there. I think there's another psychological component is that, training as a cardiology, you go through, after college, you get 4 years of medical school, then there's 4 years of 3 years of internal medicine training, then 4 years of cardiology, in my case, electrophysiology. So there's 11 years after you finish college, you're in school and training, and you're learning all of this stuff, and you gain all these skills and so on. And so you're practicing, all of a sudden some joker comes up and says, well, you really don't need to do all that stuff, just a whole foods plant-based diet can turn these conditions around. You have a hard time getting your arms around it. And so there's a psychological component that I don't really want to look over there because, I'm used to doing what I'm doing. I'm stuck in this approach. But I think there's also an aspect of fear that, maybe there is something to lifestyle, et cetera, and it may, deem what I'm doing worthless. So I think there are many factors that go into that. I don't think it's strictly economic, but we're trained in a certain way, and no one looks to the left or to the right, and no one thinks outside the box. And so I think for the most part, they honestly think this is the only approach that really works for patients.
It also would reflect, of course, on the cardiologist's own diet and what's in his fridge. And they've worked very hard, like we all have, to earn enough money to enjoy those good life foods, the filet mignon and the lobster thermidor, and they don't want to give that up, and they're not going to tell their patients to give that up, and it's no small matter as far as those psychological blocks that Dr. Montgomery elucidated here.
Diet. Can you, better? Okay. We weren't supposed to move the mic, she told us before. Okay. So anyway, if you've been in practice for 20 years, you've told people to lose weight, change their diet. You've had patients promise they're going to change their diet, they're going to lower their cholesterol, whatever they're trying to do. And let's face it, the doctor really hopes that the patient changes his diet. The patient really intends to do it. But nobody's teaching these patients how to do it. And so what happens time after time after time is the patient who's promised, I'm going to take off this weight, I'm going to lower my cholesterol, don't put me on the statin drug until you give me a chance to do it, comes back 6 months later, his cholesterol is now 10 points higher than it was the first time he was there. So you watch that for 20 years, and then somebody says, whole foods plant-based diet, you won't have to prescribe statins and the whole 9 yards. They're going, yeah, right. Well, you can't blame the person. And so one of the things that I tell people all the time is how you can really help this movement is to be the first person your doctor meets who actually gets that done. Because it may be the beginning of turning around that doctor's bias toward drugs and surgery, which he's seen have some positive effect while he's seen nobody succeed the other way. You be the first person, and that can be the beginning of changing that particular physician's mind.